Hi guys, this video is about basic ABA principles or applied behavior analysis principles. So you may be saying, what is ABA therapy used for? Well, most often it's used for children with autism, but it's also used for a lot of other things. Maybe you're the parent of a newly diagnosed child. Maybe your doctor suggested ABA therapy for your kiddo. If that's you and you just want to learn a little bit about what ABA is about, then you're in the right spot. Okay, our agenda for today. So, first, we're going to talk about reinforcement, which is really common in ABA therapy. Next, we're going to talk about punishment, and then assessment, BIP or behavior intervention plan, and summary. So, first, I wanted to say if you're interested in ABA therapy, and you're in Des Moines, Iowa area, or if you're interested in remote ABA therapy, feel free to visit Kind and Uplifting ABA. You can go to www.kindandupliftingaba.com. And this number right here, 515-303-0472, you can call that number or text it at any time. Kind and Uplifting ABA provides one-to-one ABA therapy for kiddos with autism. This means a BCBA uses an assessment to see where your kiddo is currently. After that, a BCBA writes up a treatment plan. A behavior technician implements that treatment plan with the supervision of a BCBA. So, what are the primary goals of this video? Tell you a little bit about ABA basics, and also we discussed Kind and Uplifting ABA therapy. Disclaimer. Please consult a BCBA before implementing any behavioral principles. This presentation is for informational purposes only. Okay, the big R word, reinforcement. You may be saying, what is reinforcement? Why do we use reinforcement? And how does this help with challenging behaviors? Well, reinforcement is anything that is added or taken away that causes a future increase in the likelihood of a behavior occurring. So what does that mean? That just sounds like a bunch of behavior analysis lingo. Well, yeah, it kind of is. What reinforcement is you can add something or take something away. And in the future, your kiddo is going to be more likely to do that because they were reinforced. So reinforcement could be your kiddo says his first word. He says, mama, and you want to reinforce. So you give the kiddo something like a little candy or something that's safe for him. So in the future, he's more likely to say, mama. Why do we use reinforcement? We use it to reinforce behavior or increase behaviors. So this can be very beneficial if you're wanting to see kiddos better understanding how to do skills or to use these skills more often. How does this help with challenging behaviors? Basically, we reinforce an alternative behavior, a behavior that is good, that is appropriate, that we're wanting to see. And as we see this reinforcement go up, typically you can see a decrease in the challenging behavior. Punishment. So, what is punishment? Punishment is anything added or taken away that causes a decrease in future occurrences of that behavior. So, if your kiddo stands up and bursts something out in class and the teacher goes, why would you do that? In a negative tone. And then the kiddo is less likely to do that in the future, standing up and blurting out. That would be punishing. So, here's the thing with punishment. The research shows it can have unwanted harmful effects. So yeah, there is some research on punishment that shows it can cause an emotional response. Assessment. BCBAs use assessments and observations to see where a kiddo with autism currently is with skills. Behavior analysts also use FBAs to analyze the challenging behaviors. Behavior intervention plan. So this is what BCBAs write up regarding the challenging behaviors of the kiddos. They use the ABCs of behavior, antecedent interventions, and consequent interventions. ABCs of behavior is what happens before the behavior, and what happens after the behavior. Antecedent interventions would be changing things that would happen before a behavior. And consequent interventions would be changing things that happen after a behavior. So, in summary, a BCBA works with parents and kiddos to develop a plan, writes up a treatment plan to teach skills, and writes up an FBA to treat challenging behaviors. And also, BCBA-led parent training teaches parents basic principles and what they can do to help their kiddo. Thank you for watching this video today. Feel free to visit Kind and Uplifting ABA at www.kindandupliftingaba.com or call or text us at 515-303-0472. Thanks, guys.